Hello, everyone. So, today I'm going to go ahead and talk about mental health in the justice system. Mental health is a deeply personal and complex issue affecting many individuals worldwide. For some, managing a mental health condition is challenging, but when combined with involvement in the justice system, it can be very difficult. Many individuals with mental health disorders find themselves incarcerated not because they are criminals, but because our system lacks the resources to provide proper care and intervention. And according to our textbook currently, Comer, um, individuals with severe mental illnesses often experience higher rates of incarceration, homelessness, and social isolation due to the lack of proper intervention. Also, reading the American Psychiatric Association emphasizes that the conditions such as schizophrenia, bipolar disorder, and neurocognitive disorder require specialized treatment. Yet, many individuals with these diagnoses end up in correctional facilities rather than receiving the care that they actually need. So I hope that this presentation for you will explore the challenges faced by individuals with mental health disorders in the justice system, how they are treated by the law enforcement, courts, and prisons, and how society can better support them through rehabilitation, mental health services, and reintegration programs. So let's begin. Okay, so coming into this section for mental health statistics in the justice system, want to go ahead and say how mental health disorders are common in the justice system, and it does affect a good portion of incarcerated individuals. So, along with just a lot of this information that I'm going to be stating is going to be from Texas or even San Antonio, Bexar County. I wanted to have this more related to where most of us live, and just to be a little bit more knowledge about the mental health within the justice system here. And in Texas, 70% of inmates coming in have a diagnosed mental disorder, but also there's a 90% of offenders that also struggle with addiction. A lot of the most common disorders among incarcerated individuals include major depression, coming at 29%, substance use disorder at 45%, bipolar disorder at 16%, and schizophrenia at 6%, and then other mental disorders at 4%. Based off of the American Psychiatric Association, individuals with neurocognitive disorders such as schizophrenia spectrum disorders often struggle with decision making, impulse control, and emotional regulation, which can lead to interaction with the law enforcement. And Bexar County Jail in San Antonio faces similar challenges. The estimates showing that 20 to 30% of inmates have a serious mental illness, and over 50% require some level of mental health screening or services. Now, I know on the screen you're going to see a big dollar amount. So this is 450 million of the annual cost for individuals mentally for mental illness here in Texas. However, despite this funding, the system still struggles due to several of the following reasons I'm about to mention. A significant portion of the budget is spent on housing, security, and basic needs for inmates rather than the comprehensive mental health care. Jails and prisons are not designed to be treatment facilities, so mental health services often take, a backseat to the operation. There's also a shortage of trained mental health professionals in correctional facilities. Many inmates receive minimal care, such as basic medication management. But while they are receiving their medication, they do lack the access to therapy, counseling, or long-term treatment treatment plans. Okay. Um, Texas jails and prisons are overcrowded, meaning that mental health services are stretched thin. So, inmates with severe mental illnesses often wait weeks or months to receive proper evaluation or treatment. Um, Also, many inmates with mental health disorders struggle after the release due to the limited reintegration programs. So, while they are used to getting their medication, getting some type of help within, and also having a bed and somewhere to sleep. Um, outside of the walls, um, they're pretty much left alone. So it's kind of a fend for yourself, um, or in hope that they do have family waiting for them. Which later on I will be showing y'all also a YouTube video on a similar situation like that. So going along, Many, much of the money is also spent on managing crises rather than preventing them. So there's investing in mental health courts and diversion programs and community-based treatment could help to reduce incarceration rates. But these programs are often also not as funded, um, or get less funding than the jails. Um, There was an article by Powell that stating that incarcerated significant worsens mental health conditions and how it leads to like higher rates of depression, anxiety, and PTSD among inmates. This proves that like jails and prisons are not equipped to treat mental illnesses effectively, reinforcing the need to early intervention and diversion programs. Okay, so I hope I haven't lost you. I know it was a lot. Let me try to make this one a little shorter, but let's go ahead and continue on for mental health programs and services for inmates. Um, while some programs exist to address mental health in the justice system, they are often underfunded, or insufficient to meeting the needs of the incarcerated individuals. In Texas prisons, mental health care includes crisis interventions, outpatient therapy, inpatient psychiatric services, and medication management. Special needs units provide structure environments for inmates with severe conditions. Bexar County Jail also offers screens, psychiatric services, counseling, and crisis stabilization. One of the most impactful initiatives is the mental health court. So this diverts eligible individuals into treatment programs instead of traditional prosecution. Um, However, one of the peer review articles that I had read found that public confidence in the justice system's ability to handle mental health is low. Many people believe that current programs are not enough and that law enforcement courts and correctional corrections fail to provide adequate care. Um, so this could be because of what was stated previously about, yes, they are given or they have this amount of money, but how it is used is, something different. The most common one, of course, for management is the medication management. Um, and it's more common for inmates with mental health disorders to have medication. Um, Now, what follows with the inpatient, outpatient therapy or psychiatric services, um, all the extra stuff is great, and I'm glad that they do have it, but it's a process. It can take days, weeks, or even months for it to be received. Um, Now, this does reinforce the need to expand mental health courts, maybe diversion programs and post release support to prevent mental health deterioration in jails and prisons. Okay, so I hope that last one wasn't too long, and I hope I still got you here. So, this next one's going to be for law enforcement and mental health procedures. Um, Law enforcement plays a crucial role in responding to mental health crises. The crisis intervention training program teaches officers how to de escalate situations involving individuals with mental health illnesses instead of resorting to force or arrest. Officers are trained to connect people with mental health services. Um, as mentioned before, we also have the Texas. Texas also has the mental health courts, which provides the structure alternatives incarcerated to incarceration for individuals with mental illnesses. Additionally, um, to evaluate and determine whether a defendant is mentally fit to stand trial. Um, also, in a peer review article by Powell, found that justice system involvement leads to long term psychological harm, worsening conditions like depression, anxiety, and PTSD. So, this can show that maybe uh, better diversion programs could be useful and a better structure plan so that the inmates and or incarcerated individual can receive the mental health services that is needed. So on this next slide, I went ahead and I put a link to a YouTube video, or you should be able to just click on the picture and it should take you straight to it. If it doesn't, I apologize. Um, but for this, it is a YouTube video. It's a TED Talk by Reagan Kremer. I hope I'm saying her name right. In this video, Kremer shares a story of her brother who was arrested due to undiagnosed bipolar disorder. Instead of receiving proper health care, she discussed how mental health crises are often misinterpreted as criminal behavior, leading to unnecessary arrests and incarceration. Uh, she does bring up the urgent need for policy changes, better mental health resources, public awareness. Kemmer, she also emphasizes how mobile crisis teams can prevent unnecessary arrest by providing maybe an on site mental health assessment, ensuring that individuals receive treatment rather than punishment. Um, the video also reinforces the key message for mental illness should not be criminalized, and the justice system must shift towards treatment based solutions. So, now for this one, I'm going to go ahead and talk about the Smart for Mental Health program. So, this is one innovative program addressing this issue. Is the Smart for Mental Health in Bexar County. SMART stands for Specialized Multidisciplinary Alternate Response Team. It was launched in 2020 to provide mental health support through a team of professionals, including law enforcement officers, paramedics, and mental health specialists. Um, Instead of immediately arresting individuals in crisis, SMART teams assist the situation, provide clinical resources, and ensure follow up care. Um, their goal is to reduce unnecessary incarceration and connect individuals with long term mental health support. So, programs like SMART show that law enforcement and mental health professionals can work together to create better outcomes. But for these initiatives to succeed, they need consistent funding and the public support. So, thank you for sticking it out all the way to the end. On this slide should be all my citations. And based on my citations, I just want to go ahead and conclude that mental health and the justice systems are deeply connected. While Texas and San Antonio have made progress with crisis intervention training, mental health courts, and programs like SMART, there is still a long way to go. Um, and public perception and actual mental health outcomes both indicate a failing system. Reform is necessary to prevent mental health deterioration in jails and prisons. Um, I hope that we do receive better funding, stronger diversion programs, and an increase in public awareness to ensure that individuals with mental health disorders receive treatment instead of punishment. Thank you for listening. If you have any questions or thoughts or do any further research right after this presentation, please, I'd love to hear them. I'd like to read about them. So, thank you. And let's get discussing.